10 common medications that can destroy your kidneys and what to avoid immediately. Your kidneys could be failing right now, and you wouldn't even feel it. That's the terrifying part. Kidney damage doesn't cause pain until it's too late. And while most people blame diabetes or blood pressure, doctors are warning about a new culprit hiding in plain sight. Your medicine cabinet, over-the-counter pain pills, heartburn meds, common antibiotics, even natural supplements. They're silently damaging kidneys across the globe, triggering over 1 million hospitalizations every year. One global study found that nearly 1 in 3 cases of acute kidney failure in hospitals are caused by medications, many of them taken exactly as directed. And in some cases, just one wrong combination can shut down your kidneys within days. But here's the good news. This is preventable. Today, we're exposing 10 common medications, some of them shockingly routine, that can destroy your kidneys if you're not careful. You'll learn what to avoid, how to protect yourself, and which habits make the damage worse. And stick around until the end, because I'll reveal one dangerous medication combo your doctor might not be warning you about, but it's putting millions at risk. Welcome to Holistic Habits, where we bring you science-backed, truth-driven health content to protect your body, your energy, and your future. If you care about protecting your kidneys and staying off dialysis, tap like, subscribe, and let's dive in. Number 1, NSAIDs, the silent kidney killer in your medicine cabinet. They're everywhere. Ibuprofen, naproxen, aspirin. But these safe pain relievers are among the leading causes of drug-induced kidney damage. Why? Because NSAIDs block prostaglandins. Not just pain messengers, but compounds that keep kidney blood vessels open. Block them, and blood flow drops. Pressure rises, filtration slows. And if you're over 60, dehydrated, or on diuretics or blood pressure meds, the risk skyrockets. Doctors call it the triple whammy: an NSAID, a diuretic, and an ACE inhibitor. Taken together, they can crash your kidneys, fast. Most patients have no idea until it's too late. So here's what to do. Use NSAIDs sparingly, never daily without guidance. For short-term pain, acetaminophen is usually safer. And if you're on meds for blood pressure or heart issues, always check with your doctor before using NSAIDs, because the next pill you reach for could quietly be destroying your kidneys. Coming up next, a common acid reflux drug that's been quietly linked to chronic, irreversible kidney damage. Stay with me. Number 2, PPIs, the safe heartburn pill that could be scarring your kidneys. They promise fast relief from reflux. But PPIs like omeprazole, Nexium, and Prevacid may be silently damaging your kidneys behind the scenes. Over 100 million prescriptions are written yearly, but long-term use has been linked to chronic kidney disease, sudden inflammation, even kidney failure, often with zero symptoms until it's too late. In a massive Johns Hopkins study, daily PPI users faced up to a 50% higher risk of kidney disease. And as of 2022, PPIs ranked among the top drug-related causes of acute kidney injury worldwide. The scariest part? Most people take them for years, without ever being reassessed. If you're on a PPI, don't panic, but don't ignore this either. Lifestyle shifts and milder meds like H2 blockers can often control reflux without the same risk. And if you do need one, use the lowest dose, shortest time, and check with your doctor regularly. Next up, a common group of antibiotics that could damage your kidneys after just a few doses, especially if you're not doing this one simple thing. Number 3, antibiotics, life-saving or kidney damaging. They're some of the most prescribed drugs worldwide: penicillin, cephalexin, Bactrim, even Z-Paks. But here's the part most people never hear. Up to 20% of sudden kidney failure cases in hospitals are linked to antibiotics. Some, like gentamicin or vancomycin, are directly toxic to kidney cells, damaging them at the microscopic level. Others, like sulfa drugs or antivirals, form sharp crystals that clog and inflame the kidneys. And nearly any antibiotic can trigger allergic kidney inflammation, sometimes weeks after stopping. The scariest part? Most people never link their symptoms back to the drug until it's too late. Taking leftover pills or high doses without medical guidance can push your kidneys into full shutdown. And if you're dehydrated or already on other medications, the risk skyrockets. The solution? Never self-prescribe. Only use antibiotics when absolutely needed. Finish the entire course and stay hydrated. If you're given a strong IV antibiotic, ask how your kidneys are being protected. Because next, there's a common blood pressure drug that may quietly reduce kidney function, especially when taken with other meds. You don't want to miss this. Number 4, diuretics, water pills that can quietly dry out your kidneys. They're prescribed for high blood pressure, swelling, and heart failure. But diuretics like furosemide, HCTZ, and spironolactone may quietly dehydrate your kidneys into failure. These meds flush excess fluid, but can also strip too much, dropping blood volume, scrambling electrolytes, and starving your kidneys of blood flow. And here's where it gets dangerous. Combine a diuretic with an NSAID and an ACE inhibitor, something millions do daily. And you've got the notorious triple whammy, a silent, three-pronged hit that can trigger sudden kidney injury without warning. One study found patients on this combo were rarely warned about the risks until it was too late. But here's the twist. Used carefully, diuretics can protect your kidneys. The key is recognizing danger signs. Dry mouth, dizziness, dark urine, or reduced urination mean you might be overdoing it. If you're sick with vomiting or diarrhea, skipping your diuretic for a day could literally save your kidneys. Next up, a blood pressure drug that's either your kidney's best friend or its worst enemy, depending on one critical detail. Stay with me. Number 5, blood pressure meds, kidney protectors, or hidden threat. It's a shocking twist. Some of the very meds meant to protect your kidneys might be putting them in danger. Drugs like lisinopril and losartan, ACE inhibitors and ARBs, are praised for slowing kidney disease in diabetics. But under the wrong conditions, they can backfire. Hard. Here's why. These meds lower filtration pressure in your kidneys. That's good, unless you're also dehydrated, on a diuretic, or popping NSAIDs. Put all three together. You've just created the infamous triple whammy, a setup that can silently crash your kidney function in days. And the kicker? Most people are never warned. Many are prescribed this combo for years without any mention of the risks. But there's hope. With proper monitoring, these drugs are life-saving. You just need regular blood tests to catch rising creatinine or potassium before damage sets in. Don't stop your meds without medical advice. But don't stay uninformed either, because your kidneys won't sound the alarm until the damage is already done. Next up, a natural remedy millions swear by, but it's quietly one of the deadliest kidney saboteurs out there. Number 6, herbal supplements and natural remedies, the silent kidney killers. They're marketed as safe, gentle, and all natural. But some of the most dangerous substances for your kidneys aren't in drugstores. They're in detox teas, imported powders, and herbal capsules. And that's the problem. These unregulated products often bypass safety testing. Aristolochic acid, found in certain traditional Chinese remedies, has been directly linked to kidney failure, and even urinary cancers. One weight loss clinic in Belgium prescribed it unknowingly. And within months, dozens of women were on dialysis. But it's not just rare herbs. Megadoses of vitamin C can cause kidney stones. Licorice root can spike your blood pressure. Heavy metals like lead and mercury still lurk in some imported cures. The worst part? Studies show up to 1/3 of kidney disease patients are taking supplements that could be making things worse without even realizing it. So here's the rule. No third-party testing, no transparent ingredients, no miracle claims. Because what looks natural can still be lethal to your kidneys. Coming up next, a mood-stabilizing drug that's helped millions, but may be slowly destroying kidney function in silence. Number 7, mood stabilizers and psychiatric medications. A hidden risk few are warned about. They save lives. They bring mental clarity and calm. But behind the scenes, certain psychiatric drugs may be quietly damaging your kidneys, and most patients never see it coming. Lithium is the biggest offender. It's a gold standard treatment for bipolar disorder, but over time it can accumulate in the kidneys, damaging the filtering structures. The result? A condition called nephrogenic diabetes insipidus, where your body loses its ability to concentrate urine, setting the stage for irreversible kidney disease. One study found that long-term lithium users had over double the risk of developing stage 3 kidney disease, often without any early symptoms. And it doesn't stop there. Some antidepressants and antipsychotics, though rare, can trigger rhabdomyolysis, a condition where muscle breakdown floods the kidneys with toxic proteins, leading to sudden failure. Symptoms? Dark urine, fatigue, muscle pain, and sometimes no warning at all. But here's the good news. You can still protect yourself. In just a moment, I'll share the exact lab tests to request, and the one habit that could prevent permanent damage. Next, antiviral drugs, and one critical hydration mistake that could turn a routine prescription into a kidney crisis. Number 8, antiviral medications. The silent crystallizers that can shut down your kidneys. They're meant to fight infection. But some antivirals may be fighting your kidneys too. Take acyclovir, used for herpes and shingles. In standard or high doses, especially without enough water, it can crystallize inside the kidneys. We're talking needle-like shards clogging up your filtration system, leading to sudden kidney failure. One study found up to 12% of patients on IV acyclovir developed kidney complications, many needing emergency treatment. And oral versions? Still risky if you're dehydrated. Then there's tenofovir, a frontline med for HIV and hepatitis B. It's been linked to Fanconi syndrome, a condition where your kidneys start leaking nutrients, triggering bone loss, fatigue, and long-term damage. Shocking stat? A global review found 3 of the top 5 drugs most commonly tied to acute kidney injury were antivirals. And most patients? Never warned. These meds are often long-term, and kidney function isn't monitored until it's too late. But don't worry. In just a second, I'll share a simple hydration strategy that could slash your risk dramatically. Next, chemo drugs. The life-saving treatments that can burn through your kidneys faster than you'd ever imagine. Number 9, chemotherapy drugs. Life-saving, but ruthless to your kidneys. These drugs are built to kill cancer, but they don't always stop there. Cisplatin is one of the most aggressive chemo agents on the planet. It attacks cancer fast, but also floods the kidneys with oxidative stress, slicing through tubule cells like a chemical blade. And the damage? 1 in 3 patients will suffer acute kidney injury, even with IV hydration protocols in place. But it doesn't end there. Methotrexate, when used in high doses, can crystallize inside the kidneys, forming sludge that clogs filtration like wet cement. Ifosfamide? It can wreck the kidney's nutrient absorption system, leading to electrolyte imbalances, chronic weakness, and long-term dysfunction. And here's the part no one talks about. Some patients have had to stop chemo, not because the cancer was gone, but because their kidneys couldn't survive another round. It's a devastating trade-off. But there are ways to fight back. In just a moment, we'll break down the protective protocols hospitals use to shield your kidneys during chemo. Next up, a medical procedure millions undergo each year. One that seems routine, but could leave your kidneys permanently impaired. Number 10, contrast dyes, the silent kidney killer. Hiding in your medical scans. It's not a pill. It's not a supplement. It's a clear liquid, injected before CT scans, MRIs, or angiograms. And in the wrong patient, it can shut down kidney function within 48 hours. We're talking about contrast dyes. They help doctors get clearer images, but in high-risk individuals, they constrict blood flow, build up toxins, and overwhelm your kidneys fast. The real danger? You feel fine after the scan, but days later, blood work shows your kidney function has crashed. Studies reveal that up to 30% of high-risk patients, especially those who are older, diabetic, or dehydrated, develop acute kidney injury after contrast exposure. And yes, some walk in for a routine scan and walk out needing emergency dialysis. No pain, no warning, just a silent crash. So how do you stay safe? Stick around, because right after this, I'll show you the exact questions to ask before any contrast scan, and the pre-scan hydration protocol that could save your kidneys. But first, don't miss the final section. The daily habits that quietly determine whether your kidneys stay strong or slowly break down over time. Number 11, the daily habits that quietly destroy or save your kidneys. You could avoid every drug on this list. But if your daily habits are off, your kidneys are still taking the hit. Smoking? It's not just your lungs. It slashes kidney blood flow, floods tissues with oxidative stress, and quadruples your risk of severe kidney disease, years before symptoms appear. Poor sleep? Your kidneys detox and rebalance at night. But chronic sleep loss ramps up blood pressure, worsens insulin resistance, and speeds up damage, even if you're eating clean. Sedentary living? That matters more than you think. Extended screen time leads to poor circulation, which starves your kidneys of oxygen and nutrients. Even walking boosts glomerular function, but most people sit over 10 hours a day. And the worst daily offender? Ultra-processed food. Loaded with sodium, preservatives, and phosphates, these fake foods push your kidneys into overdrive. The more junk you eat, the harder they work, and the faster they burn out. But here's the twist. The same daily habits that destroy your kidneys can also rebuild them. Stick around, because we're wrapping up with 6 powerful kidney-saving habits anyone can start today. And the last one? It's so simple. Yet most people never do it. The final fix, 6 simple habits to protect your kidneys that most people ignore. Here's what they never teach you in school, or even in most clinics. Kidney disease rarely starts with pain. It begins in silence, then explodes. But these 6 daily habits can flip the script, if you start now. 1. Drink consistently, not chaotically. Sipping water throughout the day keeps your kidneys filtering efficiently. Big gulps once or twice a day? That's not hydration. It's stress. 2. Slash sodium and ultra-processed foods. The average person eats over 3,400 milligrams of sodium daily, far beyond kidney-safe levels. Stick to whole foods and flavor with herbs instead of salt. 3. Move more. Every hour counts. Even light walking improves kidney blood flow. Sitting still is a hidden risk factor. Set a timer, stretch, walk, repeat. Get 7 to 9 hours of true sleep. Your kidneys repair while you rest. Cut the Netflix marathons and protect your body's built-in detox cycle. 5. Quit smoking today. Every cigarette accelerates kidney decline, even if your lungs still feel fine. The reversal starts the moment you stop. 6. Review your meds and supplements. Even a harmless-looking pill could be slowly damaging your kidneys. Keep an updated list and go over it with your doctor or pharmacist at least twice a year. And there you have it. 10 medications that millions of people take every single day without realizing the hidden toll they could be taking on their kidneys. The truth is, protecting your kidneys isn't just about avoiding the wrong drugs. It's about knowing how to use the right ones wisely, staying hydrated, and paying attention to the early signs before it's too late. And as a thank you for sticking around, I've put together a free 5-step kidney detox protocol, packed with simple tips, powerful foods, and easy daily tweaks to help your kidneys stay strong and protected. You'll find the link right below this video. Now, I want to hear from you. Have you or someone you know experienced kidney issues related to medication? What changes made the biggest difference in your recovery? Drop your thoughts in the comments. I read every single one. If you found this helpful, hit that like button, subscribe to Holistic Habits, and share this video with someone who might be putting their kidneys at risk without knowing it. Take care of your kidneys. They're working around the clock to take care of you.